Hi folks, it's Dr. Hutter again, and today I'm going to try something a little different. I'm not in my regular studio, but I want to share with you one of the lectures that I give, very short. I'll try and do this in 5 minutes or less, talking about disc injuries. Many of you have come to the office and we've talked about having injured discs or have sprained disc or herniated disc or a slipped disc. And what I want to do is share some of the issues that happen when we have disc injuries and try to make it understandable and comprehensive without being dull or boring about it. So what I want to do is first of all orient you to what we're talking about when we're talking about the disc. We've all seen the model of the spine. We've got, of course, the vertebrae that make up the neck, the mid-back, and the lower back, or the cervical, thoracic, and lumbar regions. In between each of those bones, we have the discs, and the discs are those fibrocartilaginous plates that join the bones together. They act as shock absorbers between the bones, but they also allow flexibility to occur. Now, the reason it does that, the reason it can be both flexible and shock absorbing is because it's made up of two different zones. We have an outer zone which is made up of fibrocartilage, and we have an inner zone which is the nucleus. What I've taken out today is a package of oxtails. You know, why in the world would I take out oxtails? Well, it doesn't matter whether we're dealing with a human or any other type of vertebrate animal. We have pretty much the same configuration. You can see here we've got this outer zone, which is kind of a fibrous material, then this jelly-like center in the center. Well, the oxtail has the same components that your discs have and my discs do as well. So we'll put that aside and we'll talk about plastic models from here in. When we look at a disc, we talk about the herniated disc, and people think about the herniated disc as having this bulb or this bulge sticking out. Well, let's go back to what the components are of the disc and how that actually happens. If we took a look at the bone, alright, so let's draw the disc and see if we can't help you understand what happens when it becomes injured. Let's see, we want to show two bones. So here's two vertebrae that sit next to one another. And in between those vertebrae, we have the disc. Here, maybe you want me to zoom in a little bit on that. The disc, of course, is made up of multiple layers, about 8 to 10 to 12 layers of ligament material that's tightly attached to the bones above and below. And then we have this nucleus, that wet center, that jelly-like material in the middle. Now, the reason it stays wet is because there's blood vessels within the bone that will provide water to the disc. We'll draw some blood vessels in here. Now, at night when you're asleep, your body absorbs some of the water from those blood vessels and it hydrates that disc so that when you awaken in the morning, the disc is more puffed up. During the day, when gravity pushes down on it, we've got movement going back and forth. Some of that fluid pushes out of the disc and it becomes smaller, which is why you're shorter at night when you go to bed. Now, if we were to cut through this and then take a look at it, it would look something like this. We would have again those 8 to 10 to 12 rings of material that make up the annulus, that gooey center, the nucleus, and then adjacent to the vertebrae, of course, we have the spinal cord, which is kind of H-shaped. There are little nerve roots that come off the spinal cord. These become the nerves that go to the anterior and posterior part of the body. And of course, those nerves go places. Now, we also have branches of these nerves that go to the disc itself, because the disc is a pain-sensitive structure. nerves go to things like muscles. We'll pretend that's a muscle. And just for the sake of ease, we'll call that an organ. Well, probably can't see that. Let's try that again. An organ. All right, when we herniate a disc, a couple things happen. We can get a tear through some of those annular fibers, and those annular fibers are tough, they're ligamentous, and of course because there's nerve fibers that go into the disc, it's pain sensitive. That gooey center migrates through the injured area and into the perimeter, creating a ball or a bubble, if you will, on the outside, because now instead of having a dozen rings of material holding it tight, instead we've got this bubble that pushes outward because we've only got maybe 6 or 5 or 2 layers of material holding it in place. Well, that pressure pushing the wall out causes pain at the level of the nerve, and of course wherever the nerve goes isn't going to function properly because of it. A second injury that can occur is when we literally tear right through the disc, and then that nuclear material escapes. It gets out of there, comes squeezing out through those fibers, and accumulates outside of the disc material. That's an uncontained herniated disc, where this would be a contained herniated disc. This would be an uncontained herniated disc. This is the person who may have had back pain and leg pain, and then they sneezed and the back pain went away, but the leg pain won't go away. This person here can maybe change position. They can lie down, bend their knees, get some ice on their back, and relieve some of the discomfort. This person can't get any relief from that leg pain because they've, in essence, got a marble squashing that nerve. Well, that material not only has a physical irritation to the nerve, in other words, it's pushing on it, but there's also a chemically mediated irritation associated with that. So you get a chemical inflammation in addition to the physical inflammation, and again, wherever that nerve goes isn't going to function properly. But the last thing I want to share with you is a third type of injury that happens to the disc, and that is the internal disc disruption. That's where the inside of the disc actually separates. Some of those layers divide. They come apart from one another and create a void inside the disc where it's separated. And now we have an area that hurts, just like all the other herniations, but we don't necessarily have a weakness in the wall. Yes, it's somewhat weakened because the structure has been altered, but it's not so weak that it's going to bust open the way a radial tear might turn into an uncontained herniation. So, this person has all the same morning symptoms as the other disc patient. Because we imbibe more fluid when we're horizontal and we've taken the weight off the disc becomes more pressurized, and for the person who has a radial or an uncontained tear, or even an internal disruption, they're going to have more pain in the morning when they wake up. They usually feel somewhat better throughout the day, and then later in the day, after their body has kind of settled down and the disc has become more sloppy, if you will, you're getting more movement in there because there's less pressure. The muscles begin to grab and hold, and now they start complaining about afternoon discomfort in addition to that morning pain. So, I hope I didn't scare you with the oxtails. I just want everybody to get a better understanding of what the injured disc actually looks like. And next time we'll talk about how we go about treating an injured disc so that we don't, A, make matters worse, but more importantly, B, help you fix it. All right, well, it's Dr. Hutter again. Hope all is well with you. Remember, we're in the middle of our summer promotion. So come down to Hutter Chiropractic and we'll get you taken care of. If you like the videos, make sure you share them with somebody else. If you know somebody who has a herniated disc and they want a better understanding of what happens during a disc injury, please pass the video along to them. All right, hope all's good with you, and I'll see you soon.